Link between mental health issues and homelessness. Everyone seems to have something to say about those living on the streets with mental health issues, and most, especially the politicians, want to lay the blame on the individual experiencing mental health challenges, whereas most are there precisely because society rejected their uniqueness and decided that they are not worthy of more than their charity. Mental health issues can put an individual at an increased risk of becoming homeless. Likewise, the horrifying state of homelessness can itself create mental health conditions in the minds of individuals who were otherwise emotionally stable when they first became homeless. There is a revolving door between the physical condition of being unhoused and the uncertain mental state of the person with no home, making it difficult to decipher which issue preceded the other. The unfathomable psychological stress of not having a place to live can be unbearable, causing some homeless mental health patients to do drugs, but probably not to the reasons you would expect. Most of the misuse of drugs or alcohol among people living on the streets with mental health conditions is an attempt to manage the distressing symptoms of the mental health disorder or other health conditions. Imagine waking up each morning to the nightmare of having no home. This is the harsh reality you can never seem to escape. Perhaps you were assaulted the first night you slept outside. Now, that violent event keeps replaying every time you see a particular street sign or hear a specific sound. Perhaps you've been ignored by everyone who walked past you for 10 years. Now, the isolation has given way to a deep state of depression. Perhaps you are a homeless 16-year-old trying to keep the secret from your classmates, although you're sure they can see it whenever they look down at your shoes. Whatever you're feeling, you're probably going through it all alone, which means you might even resort to self-treatment, drug use. When a mental health patient attempts to reduce their symptoms by taking substances such as supplements, alcohol, or illegal drugs without a doctor's prescription, it's referred to as self-medicating. It usually happens due to social system flaws. These are the main reasons some homeless mental health patients try to ease emotional pain all on their own, often to their detriment and sometimes even to their demise. One of the main and rarely spoken of reasons homeless mental health patients turn to self-help is that seeking mental health care while living on the streets can be triggering. Many mental health patients endure a rigorous process of repeat questions that is so time-consuming it leaves them in limbo for months on end. When they finally get access to healthcare, they don't want to have to keep telling the story over and over again of why they need help. They don't want to keep reliving the war they were in every time they feel out of form. It can be a very triggering experience for them. A lot of patients get aggravated because the tedious process is wasting time. They start to think of how badly they need the medicine. The average wait time in Cape Town for someone on the streets to see a psychiatrist is anything between 2 to 6 months. So you have a lot of people waiting, and a lot of them are relieving the trauma while they are applying for aid because they have to keep telling that story over and over. So now, and they have no prescription. So what are they doing? In many cases, they are self-medicating because it numbs the anxiety. In addition to the triggering routine often associated with seeking out help, unhoused mental health patients also self-medicate because they can't access traditional counseling. Some of the many barriers to care include lack of access to transport, lack of documentation, lack of employment, lack of counselors, lack of time, embarrassments about the way they look, and previous negative experiences. The political red tape can be intimidating for anyone, let alone a person who is living a constant state of survival mode because they are homeless. The road to traditional medication can take months to years for a person who lacks a stable residence. But there is an even more heartbreaking trauma ahead, because getting a prescription doesn't mean you'll get to keep it. With homeless criminalization of the rise, the odds are pretty high that the prescription they worked so hard to obtain will be tossed in the trash by the local law enforcement official. If medicine or a script for medicine is touched by law enforcement, a common practice during homeless encampments evictions, the individual has to start right back at the square one. This would be enough to deter anyone. Dignified accommodation is mental and physical health care. That's why it must be a human right. Self-medication does not necessarily equate to lack of self-control. When an unhoused individual attempts to address these mental health issues on their own, it is often due to flaws in the system. It should be duly noted that feeling anxious, isolated, traumatized, or depressed is an increasingly sane reaction to becoming homeless. If you don't want to see homeless mental health patients self-medicating in your neighborhood, then talk to your ward counselor and enlighten them about the reason this is happening, and that it would not be happening if the government was informed on such topics and actually did something constructive about rehoming those living on the streets into dignified, safe private accommodation, rather than throw them into prison-style dormitories at night and back on the streets in the morning. For as long as people without a place they can call home, they will be without the mental health care that they need. Masquita is a previously homeless man and founder of Outsider, an organization focused on enlightening people on homelessness and on accommodating those living on the streets in a dignified and sustainable manner. The views expressed here are not necessarily those of independent media. By Kate Argus. Do you have something on your mind or want to comment on the big stories of the day? We would love to hear from you. Please send your letters to arglet@inl.co.za. All letters to be considered for publication must contain full names, addresses, and contact details, not for publication. On the other hand, World Health Organization warns of antivenom shortages amid snakebite scourge. The problem of snake bites, which kill tens of thousands of people each year, is being exacerbated by climate-induced flooding in a number of countries with little access to antivenoms, the World Health Organization warned Tuesday. Each year, as many as 2.7 million people are bitten by poisonous snakes, with up to an estimated 138,000 deaths. One person dies from a snake bite every 4 to 6 minutes. David Williams, a World Health Organization snakebite expert, told reporters in Geneva. Far more people, around 240,000 each year, are left with permanent disabilities, he said. Snake venom can cause paralysis that stops breathing. Bleeding disorders can lead to fatal hemorrhage, irreversible kidney failures, and tissue damage that can cause permanent disability and limb loss. Most snake bites victims live in the world's tropical and poorest regions, and children are worse affected due to their smaller body size. Williams stressed that disabilities caused by snake bites can drive not only the victims but their entire family into poverty, due in part to the high cost of treatment, but also loss of income when the family breadwinner is the victim. A major problem, he warned, was that some regions of the world simply don't have enough safe and effective treatments available to them. Sub-Saharan Africa, for instance, has access to just around 2.5% of treatments it is estimated to need. The UN Health Agency explained in 2019 that production of life-saving antivenoms have been abandoned by a number of companies since the 1980s, sparking a grave shortage in Africa and some Asian countries. India is the worst affected country in the world, with around 58,000 people dying there due to snake bites every year, while its neighbors, Bangladesh and Pakistan, are also hard hit, Williams said. The impacts of climate change are meanwhile worsening the situation in some places, he said, pointing in particular to how flooding can often increase the number of snake bites. He pointed to Nigeria, which is currently going through a critical shortage of snake antivenom due to an influx of additional cases of snake bites that have been brought about by the flooding. And this is a problem that occurs in many areas of the world where these sorts of disasters occur on a regular basis, he said. Major flooding events in Pakistan, Myanmar, Bangladesh, South Sudan, and other countries are also being followed by a rise in snake bites. World Health Organization also warned that climate changes risk shifting the distribution and abundance of venomous snakes, possibly exposing previously unaffected countries to the dangers. And that's it from INJIBS Africa. Stay tuned to our USA and political updates.